is Dr. Evan Ostar with Fitness Education Seminars. Welcome to this edition of Fitness Insider. In the last two issues, we talked about the piriformis and the piriformis syndrome and some of the problems our clients have with their piriformis, especially including the inability to sit back the femur in the socket. So really to centrate the hip during squatting, walking, lunging type patterns. We had quite a few great questions about the piriformis, and specifically some of the things I was describing in the first video. In the first video, I talked about the modified pigeon stretch, where you would put your leg up on the table or bench, and the goal is to come up over top the hip. Now the goal with that move specifically is to release the posterior capsule and to be a very active motion. So the client is not hanging out in this position. They're not just doing this, hanging here, overstretching the posterior structures of the hip, because one of the questions was, there seems to be a lot of controversy around overstretching the hip, specifically releasing the posterior hip capsule, which then leads to hip stability. So I'm only doing that stretch per se with clients that I know and have assessed for a tight posterior hip capsule. Not just general clients that have hip tightness, it's specifically to release the posterior hip capsule. So if you have a client, or if you know how to assess your client specifically for hip joint motion, you would never want to do this on a client that just has myofascial tightness, because you can do much better and much more effective release techniques without having to do the actual stretching, which can shut down the hip. The other question was about hip stability. Does this stretch shut down the hip? Again, I'm doing a very active stretch. So even though I'm here in this position and coming up over, I'm holding for about 5 to 10 seconds and then slowly coming back out of it. So I'm really trying to activate the hip flexors, mainly the iliacus and the psoas, to help me centrate the hip and come up over the hip joint itself. So I'm moving my acetabulum over the hip joint. So I'm stabilizing my hip joint here and moving the acetabulum around a fixated hip joint. So again, I'm getting active mobilization of the hip and that posterior capsule. I'm not just passively lengthening the structures. So I have a less risk of shutting the body down. And remember, we always follow up any kind of mobilization with some kind of activation and recentering type moves, so I can activate those lower glute fibers, activate the entire posterior complex of the hip to help restabilize the hip structure. Another question was, what about impingement syndromes coming from that position that you put the hip in? Most femoral acetabular impingement syndromes come from a combined motion of flexion, adduction, and internal rotation. So this motion right here, that's where people will get that acetabular impingement. In this modified pigeon stretch pose that I was in, my leg is flexed, yes, but it's externally rotated and just slightly abducted. So when I come up over, there's less risk of impingement. If my client had femoral acetabular impingement syndrome, I may have to do some soft tissue release first to allow them a better range of motion in that position. This modified position gives our clients something to work on if you've identified a posterior capsule issue. The last question, can you use this stretch with clients that have had hip replacements and or post-surgery, so they're right after post-surgery? Those two clients, I would not use this stretcher position for. Most of our clients have had hip replacement. They may get tight around the hip, but generally speaking, that hip is hypermobile. So because it's not a true joint at that point, so the client actually has a little bit more instability, and you don't want to overstretch a hip replacement. So do not do the stretch with your clients that have hip replacement. If they're post-surgery, unless your PT specifically has them doing that stretch, do not do that stretch with your clients. And like I said, it's really important, if you do any kind of mobilization, any kind of stretching, make sure you follow it up with a stabilization so that the client can reestablish centration, reestablish connection with the muscles that support and stabilize the hip. I hope that helps clear up some of the controversy and there were questions you guys had about the hip and piriformis syndrome. Please feel free to send me any more following questions or additional questions that you may have, and we're happy you keep tuning in to Fitness Insider, and feel free to share it with clients and friends that you think will benefit from this information. Thanks and have a great day.